Thank you, and good morning. So I'm just going to make a few remarks to open up today's session, and first to do that, to reflect upon a little bit of what we did yesterday. And as I looked through the sessions and thought about them, what we did yesterday, we really had three broad sweeping concepts that we covered. We talked in the morning a lot about the benefits to sharing data, using words like liberating data. We spent a fair bit of time with a technical approach to different data sharing models and went through some examples of how different groups might collaborate and share data. Then the afternoon was largely devoted to the much more technical aspects of data standards and some of the governance around how we achieve data standards. But it was interesting throughout even the most technical discussions yesterday that the phrase that, well, it has to be done within the culture of that community kept coming up. And so that led in perfectly to today, where we are going to largely focus on culture. And we have two broad goals today. We're going to explore some policy issues, and we're going to see some examples of policy from outside the U.S., from the journals, from academia. And we're going to have our speakers address some of the cultural expectations that exist in their world, be they academia, the government, the funding bodies, etc. There'll be case examples from all of these groups. There'll be some plea from patients as to what their roles might be in this culture of research. And one of the things that, unlike yesterday, where again a lot of technical jargon was used, today the words that we're going to use are policy, practices, attitudes, facilitation, collaboration, and a key word that there'll be a whole session within this session, incentives. How do we get people to do this? I love the comment yesterday when somebody said, well, talk nice to people, ask them friendly. Say please, thank them, include them. And I think you'll hear a lot of those messages of incentives throughout the course of the session. So I'm looking forward to this session. As I said, it's a lot less technical and a lot more about how do we actually get down and convince each other that sharing data amongst ourselves is a positive thing. So first we're going to hear from our colleagues across the pond. Hans Eichler is a senior medical officer in the European Medicines Agency in London, UK, and he will be talking about some of the initiatives of the European Medicine Agency in trying to achieve clinical trial data transparency.